Good afternoon. Thank you to everyone who's taken the time to join us today. My name is Matt Van Auken. I have the privilege of serving as the Executive Director and CEO for Developmental Pathways, Continuum of Colorado, and NMSC. I want to start with a special thank you to our staff and the staff of the over 700 providers and partners that we have throughout DP to serve children and adults with IDD and delays and their families day in and day out. The global pandemic is but one of many changes that have and are occurring to the IDD system across the state of Colorado, to the people that it serves, and to our organizations. Today, I'll be joined by the rest of our executive team from Developmental Pathways, Continuum of Colorado, and our sister agency, Continuum of Colorado, that is our sister agency that provides direct services to people with IDD, and NMSC, our back-end supports team for our companies. Joining me today is Bob Ward, who is our Chief Strategy Officer, Karen Flores, who is our Chief Financial Officer, Erica Kitzman, who is our Chief Operations Officer, and Alexa Lanfer, our VP of Operations for Continuum of Colorado. And as you can see on the next slide, there are many important topics that we want to update you on tonight. Those include a COVID-19 update, an office update, including a return to work update for our teams, the new case management agency and case management redesign work that is happening across the state of Colorado with our partners at the other community-centered boards, single entry points, and healthcare policy and financing. We would also like to talk to you and update you on the Continuum of Colorado separation, the new DD waiver slots that became available July 1 of 2021, community engagement updates, public policy updates, and then finally, we'll leave room towards the end for questions and answers. And as you hopefully saw on the very first slide, in order to submit a question, because this is done as a webinar and folks are automatically muted unless you're presenting, please feel free to use the Q&A button at the bottom of your screen at any time. Type in your question, and if we have an answer that we can provide to you in writing, we'll do that right away. Otherwise, we will be happy to answer it live when we get to the Q&A portion of our time together today. All right, so first up on this list is a COVID-19 update. For that, I'm going to turn it over to Erica Kitzman, our COO. Erica?
Thank you, Matt. So the COVID pandemic has been challenging, both as a provider of supports and services to those with IDD and as an employer. We are happy to say, though, that our teams have done an exceptional job of rising to the occasion. More specifically, our office workforce moved to remote virtual operations with the help of heavy IT supports and lots of Zoom use. We quickly rerouted reception and mail services and found novel ways to safely manage the remaining on-site services and staffing. And as approved by the state, many of our programs pivoted online as well, engaging individuals and families virtually and using electronic document signing to keep paperwork moving. We also kept in lockstep with the fast-changing federal supports available to our teams regarding paid sick leave and put in place a number of other voluntary supports for our workforce, including PTO advances and assistance with medical premiums for furloughed employees. Within the community, we continued our outreach and engagement by distributing what we called boredom buster kits. Those included activities and sensory items like fidget toys and books for folks to use at home, because there are a lot of kiddos that needed some entertaining during lockdown. And in fact, we've distributed 50 kits, to kids on the CES waiver. Also, we moved quickly to create a webpage for families so that they may access needed resources related to community partners and COVID supports for things like educational supports, online camps, etc. Families really appreciated being able to find all the information they needed for school districts or for their county in one central helpful hub. We also lent additional monetary support towards families for respite. Again, with having kids at home 24/7, a lot of parents and caregivers really desperately needed support in the form of respite during this time. Educationally, we also helped provide extra tutoring for kids who couldn't attend in-person school, and we supported a school program for kids who use communication devices so they could still attend school in person. So in short, we moved quickly to put in place resources, supports, and pivot quickly to moving online where we could. Next slide. Speaking of our workforce, we have adapted quickly to realizing we don't have a need to continue to operate two main offices. So prior to the pandemic, we maintained an office in the Denver Tech Center at Inverness, and we also have a nice office in Aurora, which we call our Jewel location. After realizing we could work really effectively, largely virtually, we made the decision that it is in the best interest of our business to pivot to a much smaller footprint and still serve our community effectively. So effective just a few weeks ago, we moved all our business operations to our primary location now in Aurora. And that Denver Tech Center office is now closed effective the end of last month. It is important to us, though, to remain connected to the people we serve in our communities. So we anticipate looking at and placing ourselves within the community in what we are calling smaller satellite offices, likely starting in the Douglas County area. Please stay tuned, but we are excited about this new way of continuing to offer our services. Next slide, please. As mentioned, during the pandemic, we found great success in working largely remotely. And so not only are our teams equally, if not more productive, but in 2 staff surveys in the last 18 months, they have expressed much greater satisfaction and a much greater work-life balance in working largely remotely. They also have expressed a good deal more personal security in that arrangement. Based on that, in the fact that we downsized our office, we are largely considering ourselves a hybrid work environment, wherein many employees continue to work from home. However, based on business necessity and the need to engage in person, they are welcome to come on site and work in the office. We are also encouraging teams to get together in person on a somewhat routine clip in order to maintain their strong team identity and sense of engagement. Lastly, while masks aren't required for on-site work at this time, we do recommend staff wear them per current CDC guidelines. We are closely watching a number of vaccination requirements that apply to us. In fact, the 4 listed here either already apply, at least for limited positions, or we believe may soon apply. Starting with Denver County, that particular mandate applies to us primarily for our service providers in early intervention. So Denver County employees and other individuals providing services there in high-risk settings, along with police force, firefighters, they are required to follow that particular mandate, and that went into effect September 30th. Again, this only applies to a limited portion of our workforce. The next mandate listed here through the Colorado Department of Public Health and Environment does apply to a much broader section of our workforce, primarily our service provider, Continuum. So this mandate is really directed at other state employees, especially those who work with vulnerable populations and folks living in congregate living situations. With that particular mandate, there is a bit longer of a stretch of time in order for folks to become compliant with it. However, all folks who are eligible under that particular mandate must be vaccinated by October 31st. I'd like to take a moment to pivot to Alexa Lanfer, our VP of Continuum, to talk a little bit about that mandate within her teams.
Thank you, Erica. Yes, and that specifically affects in Continuum our group homes and our home and community support department. And so, as Erica stated, everyone needed to have their first vaccination shot if they hadn't had any yet by September 30th, and then they need to finish it by October 31st. And they're also allowing for medical and religious exemptions. However, those folks will need to be tested regularly if they decide if they have those exemptions, so that we can assure that we're keeping all the individuals that we support safe. Back to you, Erica.
Thank you, Alexa. So the next two mandates listed aren't yet in effect, but they could have a significant impact on our workforce. Starting with the Centers for Medicare and Medicaid Services mandate listed here. In late August, the White House issued a fact sheet announcing that the Department of Health and Human Services will develop these regulations, really requiring nursing homes and workers within to be fully vaccinated, and a number of other settings, healthcare settings, especially those that are in receipt of Medicare and Medicaid funding, to have their employees vaccinated. In this instance, this primarily applies to our home health agency, again, under the Department of Early Intervention. We don't yet know when that will take effect, but those teams are preparing accordingly. And then probably the largest mandate that applies to us is via OSHA. And essentially, President Biden, as part of the path out of the pandemic, is stating that employees working for large private employers, those with 100 or more employers, will be required to get vaccinated as well. And this will be issued via this emergency temporary standard through OSHA. As Alexa had mentioned, there are two options really, and that is that you present your vaccination record or seek a medical or religious exemption. So this would apply to essentially the majority of our workforce that doesn't already have other mandates applying to them. So we are preparing to scale up existing operations that we currently have in place to track and record these kinds of details. And we are keeping a close eye on when this may take effect. Bob, I think I will pivot to you for the next slide.
Thanks, Erica. Hello, everyone who's watching us. I'm Bob Ward, the Chief Strategy Officer here at Developmental Pathways. What we're seeing on this rather busy slide provided by the state of Colorado to us is a timeline of major changes that are coming to the IDD system and to the long-term services and support system in the state of Colorado. So there's a lot of detail on this slide, and you could read it all at your leisure. But the important date here is July of 2024, when all of these tasks outlined are to be accomplished. These changes are currently occupying a large amount of energy here at Developmental Pathways as we prepare for these changes, as we provide input into what the new system will look like, and as we do our ongoing work really in the middle of the pandemic. So there is an awful lot of going on here. Two major things that are going on in the IDD and long-term services and support system, the acronym being LTSS. Those are conflict-free case management, acronym being CFCM, which is a rule really by the federal government that is requiring the separation of case management activities from actual direct service provision to clients. So that's a federal rule that the state has to come into compliance with by July of 2024. The other major thing happening is a state really directed initiative called Case Management Redesign. And that's CMRD up at the top there. So the idea is the state of Colorado wants to have the goal of simplifying case management across all long-term services and supports in the state of Colorado. There are currently 10 LTSS waivers, of which Pathways manages 4 of those. The idea is to place all those waivers under one case management agency for a specific catchment area. In effect, the state is going to go from 44 different entities and catchment areas down to 20 to simplify the system and to bring case management under less agencies and make it more easily accessible for individuals who need services. This is all going to be accomplished by July of 2024. And as you can see from the graphic, there's a lot of activities that have to be done between now and then. For the purposes of our discussion tonight, there are 2 big major takeaways. DP, or Pathways, plans to be the case management agency for Douglas and Arapahoe County and also Elbert County, which we have recently taken over the case management duties for the IDD waivers as of October 1. So we plan on becoming the case management agency for our current catchment area plus Elbert County. But to do that, the other big takeaway is we will have to compete in a request for proposal process, which will come about in December 22 or January of 23. So the important dates to remember with those takeaways are later this fall or maybe the early winter, we're not sure yet. The state is going to define those new 20 catchment areas that I mentioned. We are hopeful and pretty confident that we will retain our current catchment area of Arapahoe and Douglas County with Elbert County. The reason for that being, of course, that Pathways has a long history, a 50+ year history of serving these communities with a lot of community ties that go very deep. The other important date is, as I mentioned, that we will have to compete in an RFP bid process in December of 22 or January of 23. Now, the process should be completed by July of 23, at which point the new case management agency for our catchment area will be selected. That'll give a year for the kinks to be worked out and for the new case management agency to be ready to take on all the waivers in July of 24. So there's a lot of work that has to be done, obviously, in the next several years. I can tell you that we at Pathways are engaged with our state partners and with our community partners of working through the process and the answering of all the many issues that are arising as we go to this really significant shift in how IDD services and long-term services and supports are delivered in the entire state of Colorado. So with that, we can go to the next slide, which I believe is Alexa.
Thank you, Bob. So Continuum of Colorado, we back in 2014, so long ago, the final settings rule should have gone into effect. And part of that rule is conflict-free case management, which requires the separation of case management and direct services. So what that means is Continuum of Colorado needs to be its own standalone program approved service agency, just like all the other provider agencies out there. In 2012, we formed Continuum of Colorado, prepping for that 2014 date, but that was put on hold several times. And so we have been waiting kind of in a holding pattern ourselves. Now we're aware and know that we're working towards a complete separation by January of 2023, or if not sooner. So right now, what we're doing is we're working on all of the back of the house operations that NMSC currently does for Continuum. So we're creating our own finance department and separating out. We've hired our own director of finance, and then we're hiring other members of the finance team. We're also in the process of hiring our human resources team. We're going to be contracting with a new IT provider and working towards, we also have our own lease at Jewel. So when when Developmental Pathways and Continuum both moved into Jewel, we purposely signed separate leases all in preparation for these upcoming dates of January 2023. So we already have that, and we have moved into the Jewel building, and we are all set up there. The one thing that I want to stress is through all of this, we want to assure that we maintain the continuity of services for the people that we're currently providing services to. And we have a commitment to remain transparent to those individuals and their families, assuring that if we need to make any changes in the transition, that we're going to be upfront and make sure that we're letting people know, giving plenty of time for people to make any changes or necessary preparations they need to do. But our first and foremost is making sure we're still providing the quality services that Continuum of Colorado has always provided to the people that we support. And we're excited about this option of separating out and hiring our own group and being a standalone agency. And we're very much looking towards the future. Bob, I'll turn it back over to you.
Thanks, Alexa. This slide is to bring everybody up to speed on exciting news for this fiscal year, starting back in July, of our new DD waiver slots that Pathways has received for this coming fiscal year. So as you can see from the slide, that we have approximately 200 new DD waiver slots that Developmental Pathways has been provided by the state of Colorado for this fiscal year. And that's approximately 20% of the about 1,000 slots that have been opened up across the state to help reduce the developmental disability waiver wait list. For those of you who are not certain, the DD or developmental disability waiver wait list is controlled by the state of Colorado and not by your local CCB. So the Developmental Pathways doesn't have any control over who comes off the wait list or when they come off the wait list, with the exception of emergency situations, which we then make a request to the state for an additional resource. But we are very excited to have 200 resources to offer to people for the DD waiver, which is, of course, the 24/7 residential waiver, full complement of services. I can say that at our latest pulling of data, that we have an acceptance rate of 93% of people who are offered a DD waiver take them. And we have about 15 years is the average number of years that in this current go-round, people have been on the wait list. But that is translating in large measure to an enrollment date or date of selection of somewhere around 2006, 2007. And so what that means is if an individual turned 14 and was on our wait list at that time, and they turned 14 in 2006 or 2007, they are close to receiving a DD waiver slot or have received one in the current go-round. So that gives some perspective to folks of where we are locally on the wait list. Also of interest is that we are finding that 80% of the individuals who are being offered DD waiver slots are selecting the family caregiver option, which translates to mean that individuals are staying in their family home, but working with a service agency to provide services to them while they remain in the family home. In addition to that, we are finding that the vast majority of people who are taking the new DD waiver slots have already been in the system and are typically getting our Medicaid SLS services prior to going into the DD waiver, which is something we would expect since we think we have very good coverage for folks in the areas that we serve. Just to conclude, presently, we're about 650 people who are on the DD waiver wait list as soon as available, which means that if they were offered a slot tomorrow, they would take a DD waiver slot. We have approximately 1,000, a little over 1,000 people who are on the DD wait list as a safety net at this point in time. And our entire DD wait list is a little over 2,000 folks. The other category is a C date. When someone turns 14, we put them on a C date, meaning when they turn 18, they'll finally be eligible for adult waivers. So that pretty much wraps up where we are on the new DD waiver slots. We're moving very quickly to get people enrolled. It's taking about 11 days before people decide to accept or reject a waiver slot. And it takes on average about 15 days after they make a selection in order to get services started in the new waiver slot. So with that, I will pass it on to, I believe, Matt.
Thank you very much, Bob, Erica, and Alexa. Thank you very much for covering that important information. As far as a community engagement update goes, I'm happy to report that as internal efficiencies continue to prosper, mill levy revenues increase, and fewer people are on wait lists at the state level, we find ourselves with additional mill levy from both Arapahoe and Douglas counties on an annual basis. We also receive local supports from Adams County, specifically for people we serve in Aurora, that is in Adams and not Arapahoe County. So in order to better track and spend the local supports and mill levy dollars that we are stewards for, we created a new department called the Community Engagement Department in 2020. Since then, we've worked diligently to create a better path forward in partnership with a board of directors committee comprised of both county commissioners on our Developmental Pathways Board of Directors and other board members. The Community Engagement Department staff includes a full-time financial analyst to oversee mill levy spending and better account for each county's contributions, along with the other funders, staff dedicated to exploring and operationalizing program options to develop more nimble, person-centered approaches to distributing funds to individuals and families, staff dedicated to refining community granting programming to increase and diversify funding with the goal of adding capacity and options for people with IDD, and staff dedicated to ongoing education and resource development and community partnerships. We are excited to continue working closely with the Mill Levy and Fund Balance Committee from the Board of Directors in months to come to create a long-term strategy for how to spend annual mill levy revenues and unspent mill levy revenues from years past. I'd also like to give a quick public policy update. If we can go to the next slide, please. So challenges for families, changes to services, reversion dollars, and ARPA funds. It's a lot of information. The past 18 months have been challenging for us all, but have also demonstrated our resilience and commitment to our mission. We've seen changes in how services are delivered and innovation in the use of technology to engage individuals with disabilities. While the effects of COVID on our system are far from over, we look forward to continuing to partner with individuals, families, providers, and state agencies. This past year alone, DP has participated in stakeholder engagement opportunities with local and state entities. An example of that is our partnership on a county-level task force to represent the concerns facing the IDD community. We've disseminated information through multiple channels to individuals, families, and service providers, distributed over $400,000 to families for things such as emergency assistance, respite care, and educational supports. We adapted to changing demands of state agencies to best support families and continue to deliver essential services. This includes our case managers who work diligently with families and individuals to write and rewrite service plans and increase access to meaningful and available services. We advocated for the reinvestment of under expenditures to be kept in the IDD system to ensure access to services, provider solvency, and additional supports for individuals and families. And we will continue to work with healthcare policy and financing and our state legislature as they work to spend federal funds from the American Rescue Plan Act, or ARPA, that is designated to innovate and support the IDD system. And it goes without saying, but I want to just highlight one more time how important the work is that our DSPs or direct support professionals do day in and day out, not just in Continuum of Colorado, but in the over 400 providers across the state of Colorado and the over 300 providers across our catchment area that serve individuals with developmental disabilities every single day. They overnight had to change the way that they did work and accommodate through wearing additional protective equipment and temperature checks and changing literally the way that they help support people on a daily basis. So I want to thank every single DSP, not just in Continuum of Colorado, but all of our provider agencies for the incredible work that you do every single day for people with developmental disabilities. As far as the OBH grant goes, OBH is the Office of Behavioral Health at the state. There was a grant that was awarded to Developmental Pathways to partner with them to spread the word about the Lift the Label campaign and the Colorado Crisis Line, which offers mental health and substance abuse support. So in partnering with them, we created and sent social media posts to all 20 of our community center board sister agencies across the state and asked them to share with their followers to spread the message across all of Colorado. DP held 2 focus groups with a subject matter expert interviewer, and we sent the information on the services available to 450 PASAs, provider agencies, and 235 community and disability organizations. As for the workforce crisis, no surprise here, but the pandemic has worsened an already struggling workforce. Providers across the state and country continue to struggle with recruitment and retention. The challenging situation for the workforce translates to a dire situation for individuals and families. If there are no providers to provide services, families face an invisible wait list of not being able to access services, even though they are eligible to receive them. This also eliminates choice for families and individuals, which is a high value in our system. We continue to work and advocate on a regular basis to support individuals and families in accessing services, as well as our providers. And regarding our voter engagement campaign, Developmental Pathways is excited to again be supporting voter engagement efforts. The goals of the campaign are to empower, educate, and inform our community about voting. Our efforts this year include hiring 2 paid self-advocate interns, one from Arapahoe County and one from Douglas County. Our interns are helping to shape this campaign, so please follow us on all social media platforms to see more of what they are up to. We are also hosting a virtual town hall event on Monday, October 18th from 12 to 1:30 p.m., featuring presentations from our interns, county, and advocacy partners. Please check our website for details on how to register at www.dpcolo.org. And we are also sharing our voter guide to promote understanding on our statewide ballot measures. That will also be found easily on our website. And that is it for public policy updates. So now is our question and answer portion of this presentation. I will ask our communications and marketing team if we have any questions or answers that have been, or questions rather, that have been submitted online.
Hi, Matt. No, we do not.
Thank you, Jill. All right, well, we will wrap up then. Bob, Alexa, and Erica, thanks again for your great presentations this afternoon. And thank you to Karen for being here to answer any possible questions that may have come up. We appreciate everybody's attention on all of the important changes and things that are happening, not just with developmental pathways, but with the entire IDD and delays system across the state of Colorado. Thank you all very much, and we look forward to seeing you hopefully in person very soon. Bye.